Let's bring in Representative Jason Altmire from Pennsylvania. Thank you for being with us tonight, Congressman. And let me ask you, what's your biggest problem with the Obama health care plan?
I think that we need to squeeze savings from the current system. Everybody knows we have to bring down costs of health care. It affects every business, every family, every individual in this country. Double-digit increases every year. We're on an unsustainable course, and we need to squeeze out the inefficiencies in our current system before we go outside the system to look for revenue. So this idea of taxing the wealthy to pay for health care, I don't think makes any sense.
You know, I actually read in the New York Times on Friday, $700 billion a year in unnecessary medical procedures every single year, and yet I haven't heard anyone in Congress talk about that problem at all. It's all about how we're going to pay for it and who we're going to tax.
Well, there's a lot of people talking about it. We need to improve this bill. I voted against it in committee. I want to do health care reform. Everybody here understands the importance of bringing down the costs of health care in this country for everyone, for the government, for businesses, and for families. But raising taxes on people to pay for it on the other end is not the way to go about it.
You know, the other day in Silicon Valley on Sand Hill Road, where all the venture capital people are, there was a meeting of some guys, and they were all big Obama backers, and they told a friend of mine, you know what, we just wanted a different foreign policy. We never realized he was going to go this far. I mean, Silicon Valley in California is facing a tax rate of somewhere around 55 or 60% if this plan goes through. Now, here's the thing. Didn't you support Obama? Didn't you kind of know he wanted to tax the rich?
Well, look, the plan to have the surtax on the wealthy is the House of Representatives plan, which I voted against. That's not the president's plan. The president has outlined his goals. Cost reform, bringing down the cost curve is part of what he wants to do. The idea of where to generate the revenue and how to do the surtax, that's something that generated in the House. You can't hang that one on the president. I think it's a bad idea no matter who thought of it. We need to find a way to get more people into the health care system. Clearly, access is an issue, but job one has to be bringing down the cost of health care for everybody, not raising taxes to pay.
We got 45 million uninsured people, and Obama keeps insisting this is a problem for all of America. So how come only 2 million high earners are being asked to pay for those 45 million people?
Well, look, again, that's not the approach I want to take, but it's important to remember those 45 million people that don't have health care, they get treated. They show up at the emergency room, they get whatever they need, and they send the bill to you and me. That's how it works now. We're already paying for the cost of people who don't have health insurance.
Yeah, it's just that something like 200 million people are already paying instead of just 2 million whose taxes are going to go up. So what's the first thing you can do to change the pivot point of this debate, sir?
Well, I think you have to stop the House bill if it includes that tax on the wealthy. The first thing we have to do is find the savings in our current system. And if that means you have to reduce the level of the subsidy to get people into the system, then so be it. That's what we're going to have to do. Job one has to be to restrain the growth of health care costs over the long term. Just taking 50 million people from outside the system and putting them into a flawed system isn't going to solve that problem.
Now, I read a report the other day that said for a small $1 million revenue business, that the penalty that they would slap on the business for not covering its employees amounts to about 1/3 of annual profit at that company. Are you going to let that pass? Small business seems like an important voter base for you guys.
Less than half of small businesses are able to afford to offer health care coverage to their employees right now. It's not that they don't want to. They would love to be able to do it, but they can't afford it. I don't know why anyone thinks that if you raise their payroll tax on the other end, that somehow that's going to help them afford health care for their employees that they can't afford right now. That doesn't make any sense. And you don't want to set the level at a rate where people who offer health insurance today are going to drop coverage and dump their employees into this new public plan that's out there. You have to do it in a way that's going to help small businesses afford health care and find a way that they can offer it to their employees, not just dump them into the public system.
All right. Well, I'm glad you're in Washington there, fighting for the other side of that debate. Thank you so much for being with us tonight, Representative Altmire.
Thank you. Happy to be